Well, let's
And
talk about that a little bit, about that idea, because I think so many people out there believe chiropractic care is really just for pain. And that's, you have a back problem, you go to your chiropractor, and that's where it ends for them. Whereas I know, and of course, it's much, much more. As you said, these are ailments that range from cancer to, you could say, even allergies, because if you understand, chiropractic goes much deeper than just alignments. In a sense, it's the alignment of the body that keeps it in balance. So can you go into that, how chiropractic care can go beyond the palliative and pain side of things into common ailments and chronic diseases?
well, a couple of things to think about is that a lot of patients come into my office, and I think I was in the same frame of mind when I first started my chiropractic education, is that really it's all about alignment. And alignment is a very positive part of what we do. It's very positive. So what we're talking about with alignment, we're talking about biomechanical, implications. So part of the puzzle is how well is the spine aligned? But the other really important part of it is how well does it function and its impact on neurophysiology. So, if we've got basically 24 vertebrae and 24 ribs that make up your basic frame, and for you to have any biomechanical movement, there's a lot of joint structures. There's facet joints, uncinate joints, costovertebral joints, things of that nature. And many of those joint structures get restricted. And then the body has to compensate. So if we've got 20 or 30 joint structures out of the 110 or so joint structures in the spine not working well, the 70 or 80 other joints have to compensate for that dysfunction and or subluxation, which is a term that's used in chiropractic. So what the goal is to get into these areas where there's dysfunction or disease or subluxation and try to restore better function at that level. When you do that, you're actually stimulating the body's ability to release better hormones, communicate better neurologically, communicate better from the brain, not only to the joint structures, but to the joint structures connections to the viscera. So the heart, the liver, the lungs, the kidneys. So you basically are stimulating the body's ability to take care of itself better. Can stimulate the immune system, can stimulate, for example, children, going back to children, babies a lot of times will have colic. And part of the problem is the mid-thoracic spine is subluxated or having some type of a dysfunction, and you adjust that, it's going to give a better signal to the stomach and kind of relieve the colic. Very common. Ear infections, where basically, your eustachian tube is more of a horizontal kind of plane when you're young, in your first 8 to 10 years, and it starts to get into more of a vertical orientation. But the muscle, the eustachian tube muscle, can be impacted positively by a chiropractic adjustment to open it up and allow drainage so that you don't have to go get ear tubes or, those kinds of things. Nighttime bedwetting. So kind of rambling here a little bit. So the idea is it's not just about pain.
Right.
And too many times people believe that once the pain's gone, it's kind of like the engine light's off, everything's good, and that's one of the hardest things to teach is that, hey, your spine, is really important to work with, just like anything, exercise, nutrition, even when you're feeling good, that's the important part.
Yeah. And sometimes pain is a localized injury type of pain, but sometimes it is a symptom of something deeper. It is an inflammation caused by something else that you have to get to, and it's all related. That's why just addressing pain alone sometimes isn't enough.